George Kilpatrick, Inspiration for the Nation, celebrating people we feel good about. Denise Baker joins us. She is the Director of Quality Improvement for Syracuse Community Health, a partner with Inspiration for the Nation. And even though today, by the time you see this, it's November, October is Breast Cancer Awareness Month. And so I invited Denise on to really talk to us about what you need to know, especially in our community, what you need to know to make sure that you are your healthiest self possible. So, Denise, thank you for joining us and glad to have you here. What would you like us to know about Breast Cancer Awareness Month and the critical importance, especially for women of color?
Absolutely. Just want to say thank you for inviting me once again on the show, and I definitely appreciate it. And although Breast Cancer Awareness Month is almost over, it is never over for checking self breast exams. So one of the things that I find is very important is that early detection saves lives.
Yeah,
That's the fact.
period.
The sooner that we find out, the sooner that you identify that there's a problem, the sooner we can take care of things and take care of business. So we know that stage one breast cancer has a 99% 5-year survival rate.
Mm.
So that just proves the importance of the self breast exams, making sure that if there's any concerns, if there's any type of leakage, if you're noticing any lumps or bumps, that you talk to your doctor. We know that 1 in 8 women will develop breast cancer in their lifetime. And so making sure that you discuss family history, if you need to have labs drawn so that you can see if you have a genetic mutation that puts you at a higher risk, then that's important as well. The other piece of that in regards to women of color, although breast cancer has a lower incidence in women of color, we have a much higher mortality rate, and that's because of late care seeking, late detection.
Mm.
So those are the biggest risks. Being apprehensive, nobody likes to get a breast exam, a mammography, but it is a necessary piece of screening that we perform for our women.
So let's get this straight. So, because I want to make sure I'm clear about what you just said. We have Black women or women of color have a lower incidence of breast cancer, but a higher mortality rate.
Right.
So that goes directly to some of the things that you just said about early detection screening, knowing your breasts, and making sure that you're doing the breast self exams. Those are very important.
Yeah, absolutely. I don't want to, toot our own horn, but I definitely want to toot our own horn. We have a state-of-the-art mammography unit here at Syracuse Community Health. We have several initiatives to outreach to the community regarding breast cancer, mammographies, and coming in to get your mammography. And we're really trying to get into the community so that we can, at the very best, educate everyone in the importance of screenings.
And so, from your perspective, how has breast cancer screening and education evolved over the past few years? One, you got the state of the art facility, and you can toot your own horn. That's why you're here. But because of that, that's probably one thing you would say. How else?
Like I said, we have a lot of initiatives. I think that previously, the Department of Health, the U.S. Task Force agencies recommended ages 50 and above, and so that screening has been moved down to 40 and above. So making sure that we can identify, like I said, that early detection, there's a 99% 5-year survival rate. So you go through a lot, but the survival is key in quality of life. So we have initiatives that we've worked with New York State with to identify patients that are in need of breast cancer screenings and outreaching them, phone calls. People will receive letters. We just had an event in our lobby Monday, um, in which we had several vendors. We had Melina, Fidelis, we had Shades of Inspiration. They came to see us. We had the doulas. And doulas aren't just for women that are pregnant. They help overall with women's health. So just connecting, we had actually the Department of Health here, the cancer screening. People don't recognize that just because they don't have insurance doesn't mean that they can't have a screening or that they can't receive assistance. So it's very important to make sure that you get connected. There's services everywhere, and we work together as a community to build and strengthen contacts and resources for patients and their families for breast cancer screenings.
Has the mammography exam itself improved at all, or in a sense, is it any more comfortable than it's ever been?
I would love to say that it's more comfortable, but it is the test.
It is what it is what you're going to say. It is what it is.
Unfortunately.
Okay. Yeah. Right.
Yeah.
All right. And so one of the things that what we're trying to do here is help to ease the barriers and to make sure that women know that there is access here, right? I mean, I think that that's really what we're saying.
Yes, absolutely. And I think that it is nobody likes to have a mammography. There are, for certain people, certain criterias that will allow women to have other type of testing. That has to be discussed and reviewed with their provider.
Mm-hmm.
However, this is the gold standard, and really the least invasive of all the procedures that can be done at this particular time. So if for whatever reason you need support, I know that there are several groups that are out there that are willing to participate and come with you during your mammography, give you that support that you need in order to be able to complete the test. It takes a relatively short time to have a test, usually less than 15 minutes. And then you're done and you get the results, and the provider will speak to you in regards to whether or not there is a next step. And if there's a next step, then there are additional resources that will support you during that as well. So you don't have to do it alone. It is something that you only have to do once every 2 years, unless there's something going on. And then in that case, you do it once a year. But it is a necessary test that should be completed.
So the mammography, I mean, obviously the breast exam is every month, right? I mean, the self breast exam is every month, right? And so, but the mammography you said is every 2 years or just 1 year?
Well, it's every 2 years. It's recommended every 2 years. However, right. Some women receive a mammography every year, and that's a discussion that happens again with the provider. Some people, for a number of reasons, require to have their breast exams every year, and that doesn't necessarily mean that there's something egregiously wrong. It just means that they need to be followed yearly.
So is that a new recommendation? Because I always thought that it was encouraged that a mammography exam would be annually, but no?
I think that it is not a new recommendation. That's the way that it's always been. I think that women choose along with their doctor to have their mammography done each year.
Yeah, I got you. So, right, because I was like, wait, I thought, because what I was basically saying is that I've often heard in the marketing of, health for women to get an annual mammography, but you're saying the requirement is not annually, though we see a lot of people discuss having annual. So one of the things that you do is you have health navigators and things.
We don't have health navigators, but we have care coordinators, which are very similar. Yes.
Right. Similar. And what do they do?
So care coordinators work with a number of different agencies within the community to help take care of the patient. And sometimes that is assisting with additional resources, whatever those resources may be.
Mm-hmm.
We have a very strong relationship with the cancer services, which is part of the New York State Department of Health,
Mm-hmm.
and which people that do not have insurance are
Mm-hmm.
able to receive some assistance and coverage for the tests and the
Mm-hmm.
screenings that need to be completed, and some limited treatment after that. So,
Mm-hmm.
if needed. So, they assist patients with finding transportation at times. They may have some eligibility through their insurance. There are sometimes agencies that we work with that are able to assist with transportation so that they can actually get here. So the
Mm-hmm.
care coordination really just is a supplement to the care team to help assist in identifying those social needs, the social determinants of health, and making sure that referrals are carried out to the community.
Denise Baker, Director of Quality Improvement at Syracuse Community Health. So, how do you track or measure success in increasing screening rates?
It's all data.
Yeah,
It's
yeah,
all
yeah.
data. We really just monitor using our EHR and pulling the information in the background. And we actually track it every month. We report out, we have a discussion. We try to identify areas of improvement, things that we can do to help people be less concerned about going to get their tests done. Just getting people in the door is the first step. So we reach out to patients. So if we're calling you and you see our number, please just answer the phone. We definitely want to see you. We definitely want to get you out. We work with some of the payers in our community to identify patients that haven't seen a provider at all and they need to be seen, and we reach out to those patients as well. So it's all in the data.
And so, I would assume that then you have partnerships and outreach programs uh, that are used to help locate women that might otherwise fall through the cracks.
Yeah. We're in the community. We do a lot of tabling. It's an opportunity to show put a face to an agency and to be a part of a navigation. So if I meet you out in the community, oftentimes people will say, "Hey, you know what? I'm trying to get an appointment. I'm trying to get in, or I need some assistance. I'm not quite sure what to do, or whichever." It's just an opportunity to meet people one on one and give a face so that it's not so intimidating.
Yeah, I think that's important. And just like you said earlier this week, you had a group of organizations that were there to help do that. What do you need from uh, faith leaders and local leaders to get more women to get screened?
I, I think that we need to have that discussion and that encouragement and recognition that they're not alone and that there is someone out there on the other end willing to assist them and walk them through whatever process. And it's at most one time a year.
Mm-hmm.
Making sure that you know your body, know the signs to be aware of, if there's any dimpling, any abnormalities, any discharge, come in. Don't be afraid. There's not anything that any of these providers have seen that they haven't seen before. So don't be embarrassed. Nobody is going to embarrass you. We are here to help support you. So Dr. Reed is adamant that we all, wake up the same way, and we're here to support our community. So
Dr. Reed, CEO of Syracuse Community Health. So, for a woman who's listening who hasn't had a mammogram in years, what's your message to her?
come on in. Come on in. I'll be here. Ask for Denise.
You're the right, and Denise is really, really helpful. I will have to say, no, I haven't had a mammogram, but I'm not making a joke. There are obviously men, though it's a very, very small percentage of men who do can be diagnosed with breast cancer. So don't trip. It is a possibility.
Yeah.
And I know you mentioned this earlier, but again, Black women are 40% more likely to die from breast cancer, and that, even though lower risk, still, it's something that we got to be concerned about. And we know that the resources are available there at Syracuse Community Health to make that happen. So let's see, what else do we need to know?
Um, I think that is just very important to whenever there's an opportunity, there's a lot of organizations out there, Women of Pearls, Shades of Inspiration, that focus on women of color to get the healthcare that they need. Don't be afraid. There is support out there for you, and we welcome you at any time.
Yeah, I mean, I think that's really important. And I would say to you, Denise, we just got to get people in the door, 35 and above, right? Was it 40? No,
40,
40,
it's 40.
40, 40, 40 and above. Um, we hear also talk about people taking preemptive steps because there may be a gene. What is that about?
The BRCA gene is really designed to, so some women have a strong history because they've linked this gene that's related to aggressive cancer. And so making sure that you have that discussion with your provider, they'll go over your family history, and you and your provider will make that decision together as to whether or not that's the next right step for you, or if maybe you want to delay it another year. That conversation will happen with you and your provider. Absolutely.
We should say that you're a registered nurse as well, even though you are the director of quality improvement. She's not just, she's giving you advice or information based on some qualifications, just FYI. All right. The other thing I should say is that if you could tell every listener, you said call us, what's one thing every listener can do this week to support the efforts of breast cancer awareness and prevention?
I think the most important is let's have a discussion. Let's have a discussion on the importance of knowing your body. And regardless of whatever age you are, if there is any dimpling, if there's any discharge, if there's any unusual soreness, if there's anything that's different about your breast, which means that you have to do some of those exams, then talk to your provider. There is no shame in that. And having that open communication so that you can talk with someone and get that support to go in to see that provider is very important.
Now, can I just ask a silly man question?
There is no silly question. I am here for you.
So, when are women taught to do all of this?
Well,
at what age is what I'm really asking.
So when they start their menstruation, they really should be aware. I think that conversation is so very important to have as soon as to be aware of your body as soon as possible. But when you start having breast exams, you should just be aware of your body. So
can I ask another odd question?
Mm-hmm.
I'm not being so no, I'm just gonna ask the question. So is it easier? Well, is it more difficult with enhancements that we see a lot of today? If you've had some surgical enhancement, does that make it, is it the same as if you didn't have a surgical enhancement?
Is the mammography the same?
Is the experience of self-awareness and checking the same if you've had some enhancements? And certainly, and how does that, and taking it a step further, how does that impact mammography?
So to be honest, I don't necessarily know in regards to the mammography. From my understanding, it is the same. There is no change. And they probably utilize the ultrasound as far as scanning. But as far as your self-exam and knowing your breast, you can still have like your lymph nodes. So part of a breast exam is not just palpating your breast, right? It is going into your armpit and looking for those lymph nodes and any lumps and bumps that are attached or that are leading to your breast as well. It is always important, again, to make sure that it's not just checking the center, but the breast in its entirety, which goes to the armpit.
Gotcha. All right. People somebody heard something, they haven't had a mammography in years, the phone number they should call.
315-476-7921.
315-476-7921. 315-476-7921. They're located 930 South Salina Street in Syracuse. Denise Baker, Director of Quality Improvement for Syracuse Community Health, alerting you all to Breast Cancer Awareness Month. Let's get checked.
Thank you.
Inspiration for the Nation.